The CDC cuts by Elon Musk's DOGE included jobs at the World Trade Center's health program, which helps more than 130,000 first responders and other survivors with health conditions related to the September 11th attacks. The firings and buyouts have reduced the staff by 20%. Joining us now is Anthony Gardner, who was the program's only public affairs specialist before being let go from his job. Anthony, thanks so much for joining us. How did you find out that you'd no longer be working for the program?
Thanks for having me on, Lindsay. So Saturday evening, late, I got an email to my work email inbox, basically instructing me to open it immediately, and that it's basically like a form termination letter. Unfortunately, the working at the program has been such an honor, and I know my colleagues and I were just really devastated to receive those termination letters, and we're just really hopeful that the cuts to the program are reversed, and that further cuts are prevented, so that this program can stay whole and fulfill its congressionally mandated mission to provide medical care and monitoring to sick 9/11 survivors and responders around the country.
Several members of Congress have written a letter pushing President Trump to reverse the staff and research grant cuts, but it's long been a battle to get government money, as you know, for survivors with illnesses. Explain what the consequences could now be for the people who are aided by this program.
Absolutely. So these cuts to the program are across all of our teams. So nurses who work on certifications of conditions. So if a 9/11 survivor or responder, is seen by their provider and they realize they have, let's say they get diagnosed with a cancer, they have to submit a certification request to the program in order to get treatment for that cancer. And so now with these cuts, there's going to be an impact to the review of those certifications. It could possibly delay life-saving treatment for 9/11 responders and survivors. These cuts even impacted our enrollment team. So people the thousands of people who try to enroll into the program every year to benefit from the health care that's available to them for their 9/11 conditions are not going to have access to that care then, or there could be delays with getting them enrolled in the program. So I'm really urging Secretary Kennedy, President Trump as well, please take a closer look at this and think about the ramifications that these cuts are going to have on our 9/11 heroes. Members of Congress, Republicans and Democrats, fought alongside sick responders and survivors for years to establish this program, to make sure that they would get the health care that they deserve and need. And these cuts, could be catastrophic, in the weeks and months ahead if they're not reversed.
And we know that your brother Harvey died in the North Tower. Tell us about him and what it meant for you to be able to help survivors.
Yeah, my brother Harvey, he was my oldest brother. He was 35 years old when he was killed at the World Trade Center on 9/11. Harvey was all heart. He was a wonderful role model, a fantastic brother. He taught me to fight for the things that I believe in and think of others before myself. And I just, all these years, have tried to honor his memory. First I worked at the 9/11 Memorial Museum for years to tell his story and others and make sure that they be memorialized. And, over time I began to learn about the ongoing health consequences affecting tens of thousands of 9/11 responders and survivors from that day and its aftermath. And it became, part of that 9/11 calling to be able to try to give back to that community, support that community. And at the program, I was privileged to work alongside very dedicated, wonderful, talented members, public servants, members of that program team, and who work every day very diligently. The program has never been accused of inefficiency. The program, the work that we do day in and day out, ensures that responders and survivors get the care they need. And everyone across the team is dedicated to that sacred mission. So we want to be able to just get back to work and make sure that the program is safe and protected from further cuts, and that we could continue to provide life-saving health care to 9/11 responders and survivors across the country.
And just in the 30 seconds that we have remaining, we had heard from President Trump, we heard from Elon Musk, even before President Trump won the election, that these massive cuts were going to be coming. Did you ever think that it would impact your agency?
No, in fact, when there's a government shutdown, our program is a mandatory program, and we continue operating because of that mission is so important and the care that we provide is so important. So I think many of us felt that the program would hopefully be spared from that. Many of us who were in this probationary status have actually worked for the program for more than 2 years. You know, some of our people who were fired because of probationary status accepted a merit promotion, and they moved up through the program leadership team and were reclassified as probationary just because they moved into a different position. I worked at the program as a contractor for the first year that I was there, so I've been there over 3 years. So we're losing a lot of institutional knowledge in these cuts as well. So hopefully they'll be reconsidered and the program will be made whole again so we can serve our members.
Anthony Gardner, we thank you so much for your time.
Thank you for having me. Thank you again.